to be talking about two trials that look at the duration of adjuvant trastuzumab in early breast cancer. The PHARE trial looks at 6 months versus 12 months of trastuzumab, and it's either given concomitantly or sequentially with chemotherapy. And the HERA trial looks sequentially at 1 versus 2 years of trastuzumab therapy. The major results from the HERA trial show that when you compare in a landmark analysis 1 versus 2 years of adjuvant trastuzumab, that there's absolutely no difference. In the PHARE trial, comparing the 6 months versus 12 months of adjuvant trastuzumab, the results were inconclusive for non-inferiority. The hazard ratio was 1.28, and the lower end of the confidence interval was 1.05. Since the lower end of the confidence interval was greater than 1, we can conclude at this time that 12 months is better than 6 months, and that an increase in the disease-free survival hazard ratio for 6 months is at least 5%. The problem with the PHARE data is it's short follow-up, and the number of events were much, much lower than was planned for the analysis. There were about 300 and some events, and they had planned for over 1,000. So in conclusion, for those two studies looking at length, I would say that the standard treatment remains 1 year of adjuvant trastuzumab. The other aspects of the duration trials that we heard, the HERA and the PHARE studies, were that in the HERA study, all the treatment was given sequentially after chemotherapy, and in the PHARE study, about half of the patients received sequential trastuzumab therapy. So there are 4 other studies that are looking at duration of adjuvant trastuzumab, and several of those actually look at concomitant trastuzumab. So it may be that these studies will show that you need less trastuzumab in the adjuvant setting.